Dr. Rochelle Walensky, director of the Center for Disease Control and Prevention, announced yesterday the oft-criticized agency will undergo a reset to help the organization better respond to future health threats. Now, this announcement comes amid ongoing concerns regarding the CDC's response to the COVID-19 pandemic. While it is appropriate and even healthy for the center to acknowledge past mistakes, many wonder if a reset under the same leadership is enough or if a complete overhaul is necessary. Joining me now to discuss it is Congressman and Dr. Andy Harris. He represents the 1st District of Maryland and is co-chair of the GOP Doctors Caucus. Congressman Harris, good to see you today.
Good to be with you.
We're going to talk about the CDC announcing a reset, but first, let's talk about why a reset is necessary. You're a doctor. What are your reflections on the way the CDC handled COVID?
Well, look, I think they know they got a lot of it wrong. They know they were found withholding data, not making some data public, making some decisions on data that wasn't very good. And in the end, again, requiring or implying that children, small children, should get the vaccine, when I think that the evidence is pretty good that it may do more harm than good. So, look, they know that the public has no trust in them. A reset, you're absolutely right, as you suggest, under the same leadership will result in the same, if not worse, issues.
Now, on Tuesday, Dr. Ashish Jha, the White House COVID czar, he said this about the new ways they're thinking about COVID.
There's a really new way of thinking about who is going to get infected. We used to spend a lot of time talking about 6 feet of distance, 15 minutes of being together. We realize that's actually not the right way to think about this. That's not the kind of the most accurate way to think about this. If you're outdoors with, obviously by definition, good ventilation, you can be outside for long periods of time and not get infected. So context matters, crowds matter, ventilation matters. That is a major new update in the CDC guidance.
Now, Dr. Harris, this is from Tuesday of this week, so we're talking a couple days ago. A lot of us have been saying precisely this for years, and we're not doctors. And we see something like that, and we're like, welcome to the party. And it doesn't inspire a lot of confidence in the so-called experts when it seems like it takes them years to catch up with what many of us saw as just common sense. What's your reaction to that?
You're absolutely right. I mean, the fact of the matter is that everybody, if you go around and you just walk around outside anywhere in the country, you see people have figured this out. It is not risky to be outside without a mask. In fact, they figured out for most people, it's not very risky to be inside without a mask. So the bottom line is that, look, I'm glad the CDC acknowledges that they got a lot wrong, but I am a little worried about some of the steps they've taken that would make them be able to implement protocols even faster than before. And, if you're implementing protocols on bad data, I don't really want it done quickly. I'd rather you take the time and look at good data. Again, as the White House czar has suggested, it's taken the White House 2 years to figure out that outside is actually not very high risk.
Now, tell us a bit more about the reset details as you understand them. What would they be doing differently next time than what they did last time?
Well, one of the most worrisome things is that they want to make decisions based on what are called preprints, which are initial printings of articles, scholarly articles, before they undergo peer review, before they undergo the rigorous scientific review that you expect them to undergo before they're accepted into the body of science. So that means that the CDC will be even freer to use very preliminary data to change protocols or to implement protocols. For an administration that prides itself on basing everything on science, which we know they haven't done, this will get them even further from basing things on science.
Earlier this month, Dr. Fauci, to this question of what are they basing their decisions on, Dr. Fauci was in Seattle, and during a Q&A session, here's one of the things that he had to say.
What I symbolize in an era of the normalization of untruths and lies and all the things you're seeing going on in society from January 6th to everything else that goes on, people are craving for consistency, for integrity, for truth.
What's your reaction to this idea that he kind of symbolizes this craving for truth, and that's what people want the CDC for? I feel like we live in different universes.
Yes, look, Dr. Fauci was the one who said, don't wear masks before he said you have to wear a mask, then you have to wear 2 masks, then you have to wear multiple masks. He was the one who said, if you get the vaccine, you can't transmit it to others. These basically was misinformation. These were untruths. This was his opinion being presented as sound science. And as we learned, it wasn't.
Do you think that, well, in the context of this, in recent weeks, there's a lot of concern about the FBI, the Department of Justice very recently, about them behaving in ways that are driven more by political outcomes rather than maybe what the law requires. Do you think the CDC also has been politicized?
Oh, there's no question about it. The latest example is monkeypox. The fact of the matter is, we have known, the scientific community has known for a long time that this latest wave of monkeypox is spread among men having sex with men. And yet for weeks, if not months, we were told that everybody is at risk of this. That's just not true. The data wasn't true. And to be politically correct, the CDC did not widely publicize early enough that this was a disease of men having sex with men. Had they done it earlier, we probably could have contained it a little better.
Now, Dr. Harris, this is probably a longer conversation than our time allows here, but do you have any quick thoughts on how medicine became politicized, how we got to this point where we can see announcements from the CDC and a significant percentage of the American public just kind of ignores it?
Well, I think the most important way was that there were people who really didn't like President Trump. And if he said X, they said Y. Anything he said was not believed. Again, the vaccines in the beginning, when he was promoting them and saying, we were going to develop them, the Democrats said, well, I wouldn't take it. And then when they became in power, they insisted everyone take it. This is highly politicized. I think that had a lot to do with it. The other thing is that we still have political appointees in very high positions, in scientific positions in the U.S. government. We should think very carefully about who we put into these positions to make sure that they will not politicize those positions.
And Dr. Harris, what would you do to restore that trust between the American people and the CDC and just kind of this idea of experts in general?
Well, I think you have to appoint experts with a wide variety of opinions. What we saw when Scott Atlas went into the White House and had a different opinion under President Trump's administration from Dr. Birx and Dr. Fauci, he was ostracized. Instead of what's normally done in science is you listen to everyone and come up with a consensus. That's what needs to be done. You need people of differing opinions in these positions because that's the way real science works.
Yeah. In biblical terms, we would say you need to be slow to speak and quick to hear. And in the political climate we live in, we are very quick to shut down perspectives from tribes we don't like or just conclusions that we don't like, and very slow to listen. But Dr. Harris, I want to change topics with you because this week, President Biden signed the dubiously named Inflation Reduction Act. Here's what Senate Majority Leader Chuck Schumer had to say about it.
I am confident this bill will endure as one of the greatest legislative feats in decades. It'll lower costs, create millions of good-paying jobs, and is the boldest climate bill ever.
Dr. Harris, do you share Senator Schumer's enthusiasm?
No, look, this bill is a fiasco. This bill is a $450 billion tax and spend bill. And that's if you believe that these policies are not going to be forever policies. If you think that these policies are going to be extended longer, this is about a $750 billion bill. Again, the government doesn't have the money to do it. There was no pay for, what we call a pay for in this bill. So the government's just going to have to print this money. And if anybody thinks that subsidizing these alternative energies will lead to lower costs for anyone, they're crazy. The fact of the matter is, communist China knows how to deliver energy for low cost, and that is to burn fossil fuel. We're competing with communist China. If we unilaterally disarm by increasing our cost of energy and taxing our people, our economy will suffer.
Dr. Harris, earlier this month, you were on the program with Tony, and you referred to the medical savings in the bills as smoke and mirrors. Have you learned anything since then to change that assessment?
No, the fact of the matter is these are pie in the sky promises. The only thing that predictably will happen is the cost of insulin will go down for people on Medicare because it's limited to $35 a month, and for everyone else the cost will go up. The cost of new medicines will go up for everyone except those people who are on Medicare, but that will be years down the line. And again, these are pie in the sky ideas. They won't work. This will do much more harm than good to the health of the American public.
We've got about a minute left. What should the federal government be doing to reduce medical costs for families?
Well, the most important thing is to introduce complete price transparency, which is what President Trump did in his last year. He insisted that medical providers, including hospitals and insurance companies, that they publish what they're paying for things. Medical care is one of the few things that you really have no idea what it's going to cost when you go in to see a doctor or go to a hospital for an operation. This is different from everything else we do in our economy. And the fastest way to bring down medical costs is to just have complete transparency in the healthcare economy.
It does seem obvious, and you're right, that very few other services. We get bids when we build a house. We know the price of things when we walk into the grocery store, but there is a veil of secrecy over the prices of everything inside the hospital, and that does seem like that would be helpful. Congressman Dr. Andy Harris, thank you so much for your time today.
Thank you.